The head of Florida's Child Welfare Agency is recommending stricter rules for prescribing powerful antidepressants and other drugs to foster children after a 7-year-old in state care committed suicide. But as Margie Menzel reports, the legacy of Gabriel Myers could ultimately mean more meaningful counseling for abused kids.
George Sheldon, the Secretary of the Department of Children and Families, says he might recommend further review for all children in state custody on such medications and the appointment of a new in-house state medical director to keep tabs on such cases. DCF released a preliminary finding in the Gabriel Myers case Thursday, 4 months after the boy hung himself at his foster home in Margate. The new report found a lack of accountability and inadequate supervision in every step of Gabriel's case. George Sheldon.
And I think there's also a recognition on the part of the psychiatric community that psychotherapeutic counseling is a critical component along with any kind of medication that may be applied.
Sheldon says he's had a good meeting with the Florida Psychiatric Association, whose members want to help find a solution. He also said cases should be reviewed again after the initial diagnosis. When a child enters foster care, behavioral assessment is done in the first 30 days.
That is a point in time when the child is most traumatized, probably sad, bordering on depression. Should we be making long-term diagnosis decisions at that point, it might follow that child for a long period of time.
Those assessments need to be reevaluated a month or 90 days later, Sheldon said. And longtime children's advocate Andrea Moore says medicating a child who's been abused can bury a perfectly natural reaction.
Just because a child is angry at having been abused doesn't mean they have a mental illness.
The Myers Work Group report notes psychotherapeutic medications are often being used to help parents, teachers, and other child workers quiet and manage rather than treat children. And Moore says studies show that older children are more likely to be on the medications, as are children in group homes as opposed to foster homes.
The data leads me to conclude that the older a child is, the longer they're in foster care, the less likely they are to be in a family-like setting, and then the medication really does appear to be being used as a chemical restraint.
Kimberly Foster, who was on psychotropic medications every day during a decade in foster care, hopes the department will make changes to help young people like her. She told the panel that children in state care are over-medicated. Moore agrees.
I think it's really important to note that as the children age out and are able to make their own choices, the vast majority of them choose to not take the medication, and they are doing okay.
In Gabriel's case and others like it, workers did not use procedures adopted years ago, such as keeping a form that included his diagnosis and medications. Gabriel was on several psychotherapeutic drugs linked by federal regulators to potentially dangerous side effects, including suicide, but the risks may not have been adequately communicated to his foster parents. For Florida Public Radio, I'm Margie Menzel.